Very good evening to all of you all. My name is Dr. Nikhil Bangale. I head the medical affairs for Nestle Health Science. I'm an ENT by profession myself, and thank you so much, CIMS, for this opportunity to put forth an extremely important subject of obesity. I've been given a very small slot of 10 minutes, which is okay, and I'll try my best to cover most of it in this 10 minutes. Right. So a very important science of obesity, and today you've got multiple management options. One of them, and the latest being meal replacement. Yes, meal replacement has been going on for a very long time. However, there are multiple uh, inroads in the market today which take care of the meal replacement, and that is where we as Nestle put forth this opportunity. Empowering healthier lives has always been our endeavor and our ambition, and holding true and being extremely cognizant and pertinent to the same, we put this forth. So, very quickly, what is obesity? So it's just a 10 minutes. So otherwise, I wanted to do this quick activity with all of y'all. Sitting in the audience today, so if we try and calculate our BMIs, in fact, me myself, we would probably fall into the overweight category. Please, I'm not trying to undermine or trying to offend anyone here on the weight part. However, that's the fact. Okay. So very quickly, what is obesity? That is what WHO defines obesity as an abnormal or excessive weight accumulation. This is something that we all know. Don't worry, I'm not going to keep it a lot of science here. I'm trying to be more practical on my session. However, I'm trying to touch upon the few important facts that need to be covered. It's, it's a multifactorial disease, if you see, and this is something that you need to know. So the BMI cutoffs for WHO, if I don't know if the pointer works, yeah, is around 18.5 to 24.9. So 24.9 is the cutoff. For people, just for the sake of clarity, BMI is the weight upon the meter square. That's what weight in kg upon meter square. So as I said, 24.9 is the cutoff by WHO, but what's the cutoff in India as per the consensus is 2 points below, that's 22.9. And honestly, all of us here are trying to struggle to be either below 22.9 or at least touching 22.9. Globally in 2014, this is something that we all know that obesity is on the rise, overweight is on the rise. And you can see these are the stats between the gender from 2014 to 2025. What about India? Well, we've got 135 million obese only in India. This is a staggeringly high number, and as we speak, this number just increases. Skinny but fat, a very interesting article, and I know there are a few dietitians also amongst us, and we would probably debate on the fact that is BMI the marker for obesity? Maybe no. This one latest journal had a study only done with Asians, including Indians, very clearly say that probably BMI is not the only marker. It's also the waist height circumference that matters. Obesity then is recognized as a chronic disease, not only by India, but all other international organizations. It is something that we need to be need to be cognizant of, and need to have a proper management deployment to curb the same. A lot of causes, I think we all know the causes, so right from food and activity to a sedentary lifestyle to genetic to environment to medications to certain health conditions, well, all of these contribute to the etiology or to the rise in obesity. It presents with significant complications. I think this slide says it all. Every organ in the body, every system in the body, somewhere is affected because of obesity. Right from your brain to your lungs, to your genitourinary system, to musculoskeletal, and so on and so forth. But by far, this is probably something which is the most affected today. An obese person, an overweight person probably presents with a lot of low self-esteem. Yeah, and that is something which probably I know that we've got a lot of industry professionals in the audience, but we've got a lot of healthcare professionals as well, doctors and dietitians who actually confront these type of patients, and this is a very common problem. As I said, it increases the risk of comorbidities. When I say comorbidities, it would include a plethora of comorbidities, right from hypertension to diabetes to cardiovascular diseases. And you can see that the risk of an obese individual having a hypertension or a cancer or a diabetes only increases 2 to 3 folds higher. That's the diabetes landscape of India. So we all know, we keep talking about it, nothing to be proud of, that we today are just second and in the fast race to beat China to be the diabetic capital of the world. And 90% of people with diabetes are obese. That's a fact that we all know, and it's a glaring fact that I thought I should put forth in front of you. Well, then, coming to the management, it's a multidisciplinary approach. Each person, right from the industry, right from every HCP, right to a bariatric surgeon, right to an endocrinologist, right to a physician, a dietitian, a counselor, a psychiatrist, every person has a very important role in trying to manage this chronic problem. What are the current guidelines? Well, you've got you start off with lifestyle modifications, as you can see. However, does it work for everyone? Maybe not. Motivation is the big key. We all know this. You then go to pharmacotherapy. Does it again work for everyone? Pharmacotherapy is coupled with its own set of adverse effects. And then the final, that's the top of the pyramid, is bariatric surgery, where you have a BMI of much more, where a patient probably goes for the last option, which is bariatric surgery. Where does then meal replacement come in? That is where meal replacement comes in the pyramid. An extremely important intervention, so that the patient is intervened right at the beginning, and we try and curb the complexity of the problem. What is a meal replacement then? As the nomenclature sounds, meal replacement is basically specially formulated foods which replace either whole or part of the total daily diet. That's what meal replacement means. Of course, then it would all depend on the number of calories that you give, and then just as there is a regulation for drugs, there is a regulation for nutrition. We've all heard of FSSAI. So FSSAI also has two categories, something called as FSDU, which is food for specialized dietary usage, and there is something called as FSMP. Typically, meal replacement products usually come under the FSDU category. And you can see, again, in terms of calories, you've got a low-calorie diet, which is less than 1,200 kilocalories per day. And then you've got a VLCD, or the very low-calorie diet, which basically gives less than 800 calories per day. And do I say this just because it's an industry practice? No. Meal replacement is manned with a lot of evidence, and you can see this is a recent meta-analysis, or rather the meta-analysis which is probably the highest level of evidence today, clearly shows that meal replacement today is effective. It provides clear benefits in obesity management, right from rapid and sustained weight loss, complete nutrition, decreased food cravings, and so on and so forth. Coming to a very important program or a very important brand, here I take this opportunity and very proudly want to present something called as OptiFast. We were here in the market a few years back. There were few regulations which changed, and then we had to withdraw. We are back again with the latest regulations in place, and OptiFast is probably the only product or the only commercially available meal replacement product in the market which complies with the entire FSDU. So what is OptiFast? It's just not a product, it's a program. And as I said, it's a concoction. It's a concoction of a program which helps the patient not only on the psychological level, on the behavioral management, on the dietetic management, but also on the scientific level. That's our philosophy. We know that obesity is a complex disease and we need to nip it right at the bud. It's a program that believes in multidisciplinary approach. This is a scientifically designed meal replacement. This is Optifast for you. Okay, these are the flavors. Of course, I would not want to harp much on the same. We would probably have a discussion offline once the sessions are done. But Optifast is not only a product, but it's a complete concoction or a complete program. I thank you so much for CIMS for giving us the opportunity to putting it forth. December is something that we've already launched it. It's been recommended for patients who are non-surgical patients, just a quick indication. And also, it offers a plethora of benefits for other patients, right from metabolic syndrome to patients who are already indicated for bariatric surgery. That's a glimpse on the program structure. And again, I would not go into a lot of science, but just a glimpse on the kind of studies that Optifast has. Around 80 clinical studies across the globe which mans Optifast. It's got a value proposition across, and these are the few countries where Optifast is currently already present. So with that, I think the fact that we are here as industry professionals, we have a certain power and authority with us. We are also, I think the audience also comprises with a lot of experts, with a lot of doctors, with a lot of dietitians. I think it's important that we urge, and I rather urge you that we make a pledge so that we try and curb down obesity and put forth the right management options. Thank you so much for this opportunity. Thank you.
Thank you once again, Dr. Nikhil, for sharing your valuable time and insights. And now I would like to invite Dr. Devang Sarvaiya, Head Medical Affairs, CIMS Medica, to felicitate Dr. Nikhil for being here and for sharing this valuable time.